splint would be a pillow and some duct tape. And it provides the benefit of padding. It also will render the injured area mostly immobile. And of course, here you just see your third world sticks and strips of your t-shirt. Anything that keeps that injured area, okay, from being able to move is going to help it heal and heal faster. These things will take usually several weeks to heal and sometimes a couple of months. Now, what happens if you choose not to reduce the fracture? Okay, here is a gentleman who broke his femur. This is the thigh bone, okay? He chose not to allow the doctors to reduce his fracture. Now, the body is an amazing thing. This is what happened. This is the day it happened. This is 2 or 3 weeks later. Isn't it amazing how the body has formed, it's trying to form bone cells and trying to knit that together? Okay. Oh, I moved. Oh, sorry. Okay, isn't it amazing how the body is trying to form new bone cells and things like that? But it looks pretty clear to me that this bone's still going this way and this end of the bone's still going that way. Do you see that? Okay. The problem here is that the bone cells, because they're not able to knit to other bone cells, are basically forming a eschar, E-S-C-H-A-R, which is sort of a more scar tissue than actual normal tissue and a normal bone. And so as a result, this is relatively weak. Despite that, several months later, this actually almost looks normal, doesn't it? However, this guy has a leg that's 3 inches, one leg 3 inches shorter than the other, and he fractured it again a year later. So that's the importance of reducing a deformity. Okay, and here's something you're really going to enjoy.
Pus. Everybody likes to see pus, right? Okay. These are just some minor trauma infections. We've got cellulitis here on the left, and we have just a simple laceration over there. Oh. Why are we talking about this? I don't know if any of you have seen After Armageddon, but it was a pretty interesting movie, and it was about a family that had to leave their home. I don't remember what the disaster or collapse situation was, but they kind of had to wander away and figure out how to get to a safe place. They ended up in a community after a whole lot of terrible things. And when he got there, he was chopping wood and cut himself. And he didn't tell anybody, didn't take care of it really, and he ended up going to whoever was taking care of the prescriptions, and they had run out of antibiotics. And he ended up keeling over at the dinner table from a cut because he didn't get it treated and they didn't have antibiotics. So what I'm telling you is get your Band-Aids supply now. Make sure you have lots of options for treating wounds and infections. Lessons to learn. Be careful and avoid injuries, exposure, and sickness. Make sure you're using safety goggles, safety gloves, pads, whenever you're doing anything dangerous, especially if you're chopping wood, starting fires. Protect yourself. There are those heat gloves. You work with Dutch ovens. I don't know how many times I went to touch my Dutch oven. Hello. They have those heat-resistant gloves. Get them. Any way you can protect yourself, again, prevention, ounce of prevention, worth a pound of cure. Put together a medical library. Make sure that you have resources. And I'm not just talking about the internet, but actual physical books. Get the Gray's Anatomy, get the Stedman's Medical Dictionary, get a physiology book. Get every resource you can get. You can never have too many books. It's not possible. Also, stockpile antibiotics and other medications. Now, when I say other medications, I don't just mean medications. I mean herbal. Get your essential oils. It is not possible for you in a collapse situation when you have an acre or two to grow your family's food on, to spend half an acre on lavender. Okay, and I'm sure most of you don't have Melaleuca trees for the tea tree oil. I do, because I live near the Everglades. I can get as much tea tree oil as I need, but I'm not going to plant something like that. I'm going to need my resources and my energy towards growing food, not towards growing plant material to make essential oils. So make sure you get these remedies now. I would definitely accumulate the essential oils, some salves, and store the teas. If you think you can grow an herbal garden, at least get the seeds now. If you can go ahead and grow the herbal garden, get the echinacea, the chamomile. There's so many. Find out what grows in your area and just go ahead and grow. Most of them put beautiful flowers out. They're just gorgeous. And peppermint grows like a weed, and rosemary is just a beautiful bush. So get these things planted around your house now. You never know when you may need them to cure something. And learn how to use them. Learn how to use these herbal things. Most of us know how to use Tylenol. Do you know how to use echinacea? You see the pretty purple flowers, what do you do with it? So learn all of these things, how to process them. Okay, minor wound evaluation and treatment. Before you touch somebody, wash your hands. Okay. How do you stockpile antibiotics? Did you put that at the end of the talk? How to stockpile antibiotics. Isn't that, it's here. It'll be there. Yeah. We added it. It's in the book, but we added it here. Okay. I have heard people say, oh, I don't have to wash my hands. That's my child. That's my husband. Or that's my wife. Your hands are just as dirty for a relative as they are for a stranger. So wash your hands before you touch a wound. And then put the cleanest gloves on that you have. If you just have those non-sterile ones that pull out of a box, put those on. Your hands are dirtier than that wound probably, because if it was just opened up, your hands are covered in bacteria and you're just going to stick it in there. Don't do that. So if you can use sterile gloves, great. If you only have the non-sterile, that's fine. Any protection is good. The first thing you're going to do when you see a wound is you're going to look for foreign objects, bleeding, and sources of contamination. If you see things sticking out, get them out quickly. You don't want to be pushing on a wound that has a stick in it or a splinter. You've got to pick those out first. The way you're going to look for those is you're going to irrigate it very quickly so you can get a visualization. Now, if it's filling up with blood, you're going to have to do that very quickly, and it may be washing and dabbing with gauze, but you don't want to press on something that has splinters in it. So make sure you pull those out. Then you're going to do your pressure dressing. Irrigate and scrub. The betadine ratio is just generally, y'all seen the povidone iodine, 1 part to 10 parts water. It'll give you a nice antiseptic wash. So give it a good washing. If you don't have betadine, you can use some tea tree oil. And there are lots and lots actually of essential herbs, essential oils that you can mix in water that make great, awesome antiseptics. Apply an antiseptic after you've washed it, but this is going to be staying on. This is actually going to stay on the wound. You're going to use a little antibiotic ointment, maybe a little bit betadine around the outsides. Again, raw honey, fantastic to help a wound keep from getting infected. And there's something called sugardyne in the veterinary stores. I haven't seen it for sale for humans, but it's just a mixture of sugar and betadine. And it works similarly to honey as far as its antibiotic properties. And then bandage the wound and change it regularly, and of course, watch for infection.